Welcome to this special edition of The Tea with April. I am so pleased to have with me the former Surgeon General of the United States, Regina Benjamin, Dr. Regina Benjamin. Hello, thank you for joining us.
Oh, thank you so much for having me. Good to see you again.
Always great to see you. You know, health is always at the forefront of so many people, but right now in this administration, particularly after what we saw in Trump 1, Trump 2 is giving us a little bit more than what we expected. Right now, we're seeing the red state of Florida uh, let the kids go to school now. They've removed the vaccine mandates for school-age kids. Dr. Benjamin, I remember when I went to school, they gave me polio shots. Remember that shot when we were kids that marked your arm?
Yep.
The mark is now gone, but I remember that. And we had the polio drink, the polio shot, we had measles, mumps, we had tetanus.
The little sugar cube.
Yes, we had
Yes.
all of that. And now, what does this do? Because these diseases travel. We've seen measles, we've seen all sorts of different, the flu, we've seen all sorts of different things that are debilitating, chronic, and even deadly. What does this do if one state does this? What does this do for us?
So April, you know that I am not interested in, well, I can't say I'm interested in the politics of, I'm a family physician and I want to talk about the things that affect everyday patients. This just happens to be one of those. How it will affect them. As you so rightly said, these vaccinations that we have protect our children, protect the families when they go home. The kids are at school, and all these illnesses spread amongst kids. So when we protect one child, we protect them all, and we also protect the families. As you said, we used to take vaccines before we went to school, thought nothing of it. And what I'm seeing with this entire anti-vaccine, I guess, movement or whatever, is that we've done such a good job. People have not seen kids that were sick. They have never seen a child with whooping cough. If a mother or child sees her child with whooping cough doing and can't catch their breath, she will do anything in this world to give that child that last breath and make sure that they can get another breath. There's nothing that they wouldn't do. They've never seen it because we eradicated those things or made them so that they were so rare they never saw them.
Yeah.
For the last 12 years or so, we haven't seen cases of measles because we did such a good job. And the first time was this past spring that we saw an outbreak of measles. And measles spread so fast. And it's usually, it is during the time in the winter time. And the only reason that we got through that with only 2 children dying was because it was the winter time and summer came. And now we're getting ready to go back into school, back into close contact. We're going to see more and more measles happening.
Close contact indoors. Contained spaces with not the kind of ventilation an outdoor space offers.
Exactly. And so you're going to see more and more of that. So having a state like Florida, and I live in Alabama, and I'm 40 minutes from Pensacola, Florida, and so it's very close to me. To have that kind of irresponsible type of activity happening is just hard to think about. I mean,
and transmission of anything is easy because the droplets, you could walk into droplets. It doesn't necessarily have to be someone right in front of you who sneezed, but something could linger in the air for a little bit, right?
Just like with COVID wasn't droplet, although I will say you need to wash your hands constantly because there are droplets around. But if it's aerosol, like COVID is, it basically, I give you the example, when you walk by somebody who had some bad cologne or bad perfume, they walk right past you, but that smell stays. And that's what aerosol is like. It's there, even though they're gone.
That is a great analogy. And it's like driving in a car and you smell something in one space, but it travels with you for a minute in that car.
Exactly.
Great analogy.
Exactly.
That's the analogy we need to bring it home so people can really understand. So
I
before you,
always want to make sure that I try to protect people or teach them how to protect themselves. And I always want to say, continue to practice good hygiene, wash your hands a lot because we touch our face more than
yeah,
we we just do as people. Wash your hands more frequently. If someone suggests, particularly a health professional, start to suggest you wear a mask, then you wear a mask for that period of time. I was on a plane 2 days ago and I wore my mask across country because we're seeing more flu, we're seeing more respiratory, and we're seeing more cases of COVID.
So let me say this to you. I was just in the grocery store. I saw it wasn't just older people. I saw more and more people wearing this because people are getting sick. People are getting sick. And you just earlier this year, it was so interesting. In February, I got I had flu B. And within 3 weeks, I got flu A. They said my system had not built up. And in flu A, I thought flu B almost killed me. Flu A they said was close to COVID. I was down that thing, and I had on a mask. And a mask is not always the number one insurer, but how serious are these illnesses?
Well, everybody's different. So depending on what your immunity is, what your state of health is, for one. But you wear the mask for another reason. You don't want to get infected, but you also don't want to get infected and don't be sick, but take it home to someone. You want to protect other people. And so as a physician, when I'm on these, like I'm going now, when I go back home, before I go see patients, I'm going to test for whatever I can because I don't know what I may have picked up. So you want to make sure you don't spread it to someone else unknowingly because you'll never forgive yourself if you gave it to your grandparents or someone. And in addition to, you don't want to get sick either.
This thing has gotten so political, and I'm sorry. It's a lifesaver. So let's talk about this moment in COVID. What are your concerns about COVID? I mean, it's gotten political. All of
Unfortunately, that's what I was kind of started out with. I don't like to talk to politics because it should not be political at all. This is our lives, our health and well-being, our futures, anyway, it's our life. So,
but in Florida, they're saying that they said you have the right to choose if you want a vaccine or not. But that sounds almost like to me the right to life. It's going down a lot. I mean, you say that in one instance. I'm not getting political on you, but they just said that.
mhm.
And now it's just so much contradiction. But now we're in COVID. This has been politicized, but it's not politics. This is a cloth or some kind of material to cover your mouth, hold your nose, and put around your ears to protect yourself and your family. Do you think this is a necessity this winter?
It depends on whether you feel like you're completely healthy. So my advice to people is say, if you have any kind of illnesses or diseases, underlying diseases, sometimes you don't even know, like high blood pressure,
Yeah.
diabetes, you've had a family members had a stroke or you've had a stroke, or
Mhm.
you're overweight, anything that decreases your ability to fight off an infection is
Mhm.
what you're at risk. And so do as much as you can. I see you spraying your hands, but I also believe soap and water works too. So use as much as
Okay.
you
Okay.
can. But I carry that spray with me. It's alcohol is what it is.
Yeah.
But it's better than nothing because we do put our hands to our face all the time.
I carry that, and I also carry those antibacterial hand wipes in
Right.
my car always, because when you get out, I've become a germaphobe because of all of this. And yes, the older you get, the more, I mean, I don't care. You must, if you're superhuman, if you don't have at least one or two pre-existing conditions. But the older you get, you have to watch your health.
You do.
Now,
Babies and children do too because they're still developing their immune system. So the very infants have their mother's immunity, but they have to develop their own. So you'll start seeing them get ear infections and things. That's them building up their immunity. So we have to protect those who can't yet protect themselves.
wow, it's basically the whole population. So here's the next piece. there is a hearing on the Hill. The current HHS Secretary, Robert Kennedy, is testifying. And while he's testifying, there is a petition. More than 1,000 current and former HHS employees have signed a petition calling for Robert Kennedy Jr. to resign. Do you know anybody who signed that petition or that letter?
Oh, yes. I know all the former CDC directors and acting directors, of course, I know them all and have high regards and high respect for them. I've worked with them, many of them, and I guess I've worked with all of them, come to think of it. And many of the officers that work at CDC were as Surgeon General, I led the United States Public Health Service. And so the Public Health Service officers, many work at CDC. And so, yes, I know lots of them. And unfortunately, sadly, they're depressed, they're just discouraged. So many have been just let go. These are some of the smartest people in the world. My officers, for example, and the reason they're officers is that when an outbreak happens someplace in the world, these officers, I would deploy them to go to those outbreaks. You can't make a civilian go into harm's way, but when you're in the military, you can. And the United States Public Health Service is a branch of the military. Like the Air Force protects your skies, and the Navy our shores, we protect the public's health. So our officers stationed around the world. And unfortunately, many of them, have been they've been fired or let go, or some of them were told they could come back, but they don't have any place to come back to. So these people who were surveillancing the world are no longer there. And so that puts us at risk. That the other, I guess, disheartening part is how people have demonized public health. And these are the folks who are trying to save our lives, doing things I have a saying that if public health is really working, you don't know it. You don't notice it because it's in the background. When you assume that when you drink that glass of water out the faucet, that water's clean. Somebody's monitoring that water and somebody's making sure. When you see the food that you eat, you buy chicken or you buy something in the grocery store, somebody's been monitoring. Well, many, up to 60-70% of those folks have been laid off or gone with the government layoffs. They're not there. So who's monitoring all of this? We're going to see many more foodborne illnesses break out. We're going to see these things. You're not going to see it right away, but over time, if nobody's watching, nobody's going to necessarily do it. And we take these things for granted. So these are the things that, getting back to your question, which I never answered, with RFK Jr., he says he wants to do prevention. And my whole career has been around prevention. We released the first the only national prevention strategy with the federal government. Yet what you say and what you do is not always the same. And as Surgeon General, I have a real passion for smoking and smoking cessation, and the cigarette warning on the package. Everything we've done, we have reduced the number of people smoking over the last 10 years or 15 more years. All of those things are now being just eliminated. The anti-smoking or smoking preventions, Office of Smoking and Prevention at CDC is gone. Even the 1-800-QUIT lines are not going to be funded anymore. These are things we know are working, but all of those things are being torn down. So I would say, watch what they do and not what they say.
Believe them when they show you who they are. Maya Angelou said that. She sure did. One thing that you say about prevention and also testing, what a lot of people don't know, and it shocked me when I found out that with COVID, how people can tell that the numbers have gone up. Because a lot of people, we have these home tests now, and people are not necessarily going to the doctors anymore because you kind of know what to look for.
Is the water and the sewage the numbers?
Yes. Yeah. People test, they see when you go to the restroom, the levels, they have testing in the water, the bathroom water,
Effluent, it's
the
called.
sewage. Say it again. I'm sorry.
Effluent, the water out of the septic tanks or out of the sewage processing plants, and we measure those, and we can see that rise before you start seeing people, and we can notify the states, notify the counties, so that they can have things in place and start putting in preventive measures. And yet that surveillance is one of the other surveillances that's being less and less. So
That's been cut too?
it's all, when you cut the people and you cut the services, because you have nobody to do it.
So then we wonder why it's on the rise, and we don't know, because the sewage was an indicator, how they've been testing the sewage, and that was an indicator. So we don't necessarily, oh my gosh. It's
And
like,
that's the other thing, is that what CDC does is, again, people don't, if it's working, you don't notice it because it's working, it's in place. All of the things that are being monitored, as a physician, we would get something called it was called a mortality and morbidity weekly. And it was, the CDC monitors all the illnesses and things that are going up and down. And every week we would get it. And as a physician, you look for it. You look for it in your health department, state health departments. We rely on it to see what is moving, what illnesses are rising, and what we need to be prepared for. Those aren't, they were put on hold for a while. And now that they're coming out, we don't know if we can trust the data. And that's a real problem. And that comes back to tomorrow's hearing with RFK Jr., is that, can we trust what we see? And trust is just like in a democracy. If you don't have trust, you don't have a democracy. In health, if you don't trust your healthcare providers, your healthcare system, what do you do?
Do we trust the current vaccine that's out? Do we go get a vaccine now for COVID?
I tried to get mine yesterday, but it wasn't available here in.
Now, I've been hearing that, because they're saying that the current, I'm glad you said that, because I'm hearing that they're saying that the current vaccine for the current vaccine that's in the shelves, or they have, is not adequate for the current strain.
Well, we don't know that it's adequate. Usually every, I guess, early part of the summer, we see what's the rise of viruses and the flu and COVIDs around the other hemispheres. And then we make the current vaccination based on what kind of variants and changes you have. So last year's may not be as effective as the new one that they're going to make. Usually the new ones come out right after Labor Day. So they should be coming out very soon. And so when you heard those recommendations from CDC that it's only for 65 years and older, they're referring to this year's new variant that's going to be coming out.
But you hit something. Do we trust this new?
And everything that we're hearing, we're saying, is decreasing trust. People don't know who to trust. And when you don't know who to trust, you don't trust anybody. And so that destroys the entire system.
Let me tell you what I trust. This little mask right here. I trust this little mask.
It'll help, but it's not 100%.
I know. And
I recommend people who can get a vaccination, get the vaccination, because what we do see right now is, I've seen a rise recently in COVID, and as well as starting to get RSV and other respiratory infections, is that particularly with COVID, you're not as sick as we were when we didn't have the vaccines, because it's not as virulent, and at least you have some protection.
But what about those who never got a vaccine?
They benefit from those of us who do get a vaccine, because
Herd
immunity, meaning we pass it to each other, and if each other have gotten vaccinated, it dies out. And so they benefit from us.
I could talk to you forever, and I hope I haven't scared anyone.
And that's the one thing I don't want to do, is I don't want to scare people, because there are things we can do, and I will say them quickly, is that we have common sense, and we need to use our common sense. And one of those things is like washing our hands. We know we need to do those things. But when people tell you something and you know better, don't necessarily take it for face value when somebody's telling you, oh, well, the vaccine company's just doing it for money. Well, they might be, but it's helping me. So you've got common sense. Use your common sense.
All right. So before we go, you have something that is close to your heart that you want to share. I find it very interesting, and I think you're absolutely right. Tell us what that issue is.
So this is just like, I go through these things. What's bugging me lately? Well, this one is one. And that's the fact that about cannabis and elderly people. Um, right now, 40 out of 50 of the states, medical use is legal. In 24 of those states, recreational cannabis is legal. So don't be surprised that older Americans are quietly turning to cannabis, not to get high, but to help with problems like pain and trouble sleeping and stress. And
Glaucoma.
yes, and a recent poll showed that 1 in 5 adults over 50 had tried it for the past year for some of these minor aches and pains that they have. And so that's concerning me because they're not regular. I mean, it's regulated, but it's not,
You don't know the dosage. You
you don't
don't.
know the dosage, and it's often confusing because they can go be all this dangerous stuff in the marketplace. So older adults are going to these recreational stores, not to medical sources. So it's like going to the wrong place to get your
Let me tell you, I'm
help.
gonna tell you something. Some of our they might be doing it for pain relief too, but these older adults, this crowd of older adults are different. They are on Viagra. They're doing a lot, and we know that they're on Viagra because we are hearing about
Yeah.
certain things, certain diseases climbing in the older population. They still want to be young and hip.
And some of them are young and hip, and so hopefully those of us who are older aren't dead yet. We're as far as activities and energetic and all that stuff.
But I agree about the dosage because people like those CBD oil things, people give you a CBD oil roller to help calm you. That people don't realize you rub too much and it causes diarrhea. So I agree with you.
And
I
many of the things we've seen, like emergency room visits have gone up in the past couple of years with this, and some of these people, older folks, don't regularly, they'll show signs of dependence on cannabis. But what we can do, and we need to ask our regulators, legislators to make these products safer and put in place that we don't need to be just using smoking or vaping. We also have other kind of packaging we can do, other kind of dosaging we can do, and we can have lower dosages. If we can make different dosages available and make it easy and give better guidance, better labeling. And doctors, we need more education on how to prescribe these cannabis products. And the bottom line is that it can help, and it does help, especially in cancer patients. It can help, but because they're already using it, we need to be really aware and make it more safe and responsible.
So if you get one gummy, do not eat the whole gummy. Okay, that's what I hear. I don't do it, but that's what I hear. Do not eat the whole. Take a piece of the foot, a
And
piece.
there are some companies out there who are starting to put it in other delivery methods like a spray or even pills that are lower dosages. So there are other ways to deliver it than just smoking or candy and stuff.
Well, what a way to end this conversation. The tea. Don't
It's
forget
always
what we
so
said.
nice to talk to you, but it's, these are serious type issues. One thing I did want to mention to you about Florida, because I'm right next to Florida, is that the health officer or whatever, his title is Surgeon General, which don't confuse it with the United States Surgeon General, it's different. But some of the things that he's been pushing are very disturbing. Like one of the things he had pushed before was getting rid of fluoride out of water.
I
If
need my
you
tea.
got, I mean, older people like me remember when you used to say, "Look, Mom, no cavities." Well, we don't see kids with cavities anymore. Kids have perfect teeth because of fluoride. And one of the biggest things around heart disease and cardiovascular disease is bacteria from bad teeth. And so all these things are
God.
just hurting people. We have to be very careful about what we are doing in our public health. And
Oh
my
my,
officers and my public health workers are being targeted. Their lives are being threatened. They're doing these things trying to keep people healthy. So if you know somebody that works in public health, please give them your support and give them a little encouragement because they need it right now. After that shooting at CDC, all those bullets were there. Even their daycare, they don't trust taking their kids to the daycare on campus anymore. Just
but
anyway, I digress. But basically, acknowledge the fact that our public health servers are trying to help you and trying to keep us all safe.
well, what a way to end this segment. We've talked about bacteria and fluoride, and you're right about that because a lot of people who have like heart murmurs or something used to have to take antibiotics before they went to the dentist to prevent that bacteria. Why do I know all of this stuff about stuff? It's crazy, but I guess I'm supposed to know because that's why I got a show. But I appreciate you from the gummies, for the older folks, you know what the gummies I'm talking about, to the fluoride, to this moment of vaccines, um, or not to vaccine. There will be a spread if we don't vaccine, guys. So we just heard from the former U.S. Surgeon General, Regina Benjamin, and I want to thank you for joining me and sipping some tea today on the Tea with April. Thank you.
Thank you so much for getting good health information out there to your listeners.
Thanks.
Thanks.